What lesser-known preventative medical tests/screenings/procedures should people in their 20s or 30s get? Not a test that you get, but a freebie you can do yourself. Get to know your boobs or your balls. You do not need to be old to get cancer. The earlier you catch a difference to what's normal for you in those areas, the better your odds of getting through it relatively well.
MD here. STI screening including HIV, chlamydia and syphilis can hide with only subtle symptoms. Have seen at least a few positive cases where there's no history consistent high risk. Even if you're monogamous. Don't risk it. Gum/dental and mouth health. Serious. It's not just teeth. My best friend had some serious cancer crap in his throat. Caught it early because of a silly sore throat. It wasn't just a cold. Had no clue. Saved his life.
Go to a dermatologist for a full-body screen/check. Sun damage is real. Definitely get a skin cancer screening. No one thought that I would have anything, but I went just to get checked a few days after I turned 21. Now I'm halfway to 23, and I will have to go every 6 months for the rest of my life. I have gotten 4 stage 2 melanomas removed since that first appointment. This is the first time since then that I am cancer-free and I no longer feel sick all the time. Get screenings and immunizations for sexually transmitted infections. Here is one that hasn't been mentioned yet. Get your titers checked for childhood vaccinations. It's a pretty simple blood test. I found out at around 25 that my Hep A, Hep B, and mumps all failed and rubella was borderline. The Hep A and Hep B were done immediately at my PCP's next time I saw him, or were at least started. That was fine. I needed to get an MMR booster, which was surprisingly difficult because at the time most pharmacies didn't have the in-house vaccinations. My PCP didn't have it because he only saw adults. The pediatricians who had MMR stock wouldn't see me because I was an adult. It took my doctor like 3 weeks before he told me I had to go to a very expensive travel clinic who didn't take my insurance, BCBS.
Look up the USSF. It is where we doctors get the tests that we encourage you to do.
Women, get your pap smears.
BRCA tests if you have a family history of breast cancer.
Get your eyes checked. Your eyes have a ton of incredibly sensitive blood vessels and will give you a good indicator of your overall health. These are some medical conditions you can detect with an eye exam: diabetes, high blood pressure, lupus, cancer, MS, and impending heart attacks. Get your shit checked.
I'd go with an iron panel. It's not normally tested, but my brother just found out he has hemochromatosis at 31.